Welcome to today's podcast. My name is Abbie Cornett, and I'm the patient advocate for IG Living magazine. This podcast is brought to you by IG Living to give readers the chance to hear directly from healthcare experts on topics that matter to them most. Today, we're talking about something nearly every patient receiving immunoglobulin therapy has experienced at some point, and that's side effects. Our topic today is treating side effects of IVIG and subcutaneous IgG. And joining me is Michelle Greer, RN, Executive Vice President of Sales at New Factor, Specialty Infusion Company. Michelle has had years of experience working with both patients and clinicians helping people manage IG therapy safely and effectively. Michelle, I want to thank you so much for being here today. Before we get started, can you tell our listeners a little bit about yourself and your experience? And how did you get started working in infusion therapy? And what led you to focus so much on patient safety and comfort with IG treatments?
So thanks for having me, Abbie. I am an RN for almost 40 years now.
Because I
And
met you probably 20 years ago.
right out of college, I really took an interest in IV therapy in general. So I got an IV certification and I was working in home care at the time. And I really sought out all the home infusion patients. And a few years later, I got into IVIG. Sub-Q was not really a thing at the time. And I was administering that. And then I got into nurse management and then I ventured over into sales, but still stayed very close to the clinical aspects of immune globulin therapy.
That's great. Like I said, we've been doing this for a while now.
Yeah.
For listeners who may be new to the treatment, can you explain what intravenous immunoglobulin therapy, also known as IVIG, and subcutaneous therapy, also known as SCIG therapies, are, and why they sometimes cause side effects? Give them a little idea what's happening in their bodies during these treatments and what can make some people react differently than others due to these treatments.
Sure. Well, IVIG, IG stands for immune globulin, which is essentially antibodies. And IVIG and sub-QIG are made from donors, thousands of donors that go into each batch and dose of IVIG. So you're getting an array of all different antibodies. So when those are infused into the system, IV or sub-Q, it is going to stir up an immune response of some sort. And that can range just from mild flu-like symptoms to more severe headaches, nausea, vomiting. And then the most severe adverse reactions with IV would be a thrombotic event where you actually have a blood clot that forms, anaphylaxis, which can occur with any medications that's infused. Aseptic meningitis is another one that can happen, where you can get a headache, but this would be like a severe, light sensitive, debilitating headache. And then lastly, renal failure, which over the years, with the stabilizers moving away from sucrose and more into other forms of sugars or amino acids, that side effect is really not a
Not
huge
as
concern anymore, but it's still something to consider.
I was going to say, years and years ago, I got aseptic meningitis, and it is
Oh,
rough,
yeah.
rough. That's all
Yeah.
I have to say.
Yes.
With that being said, though, IVIG is known for being life changing, but a lot of patients that do encounter those mild side effects like headaches and body aches and fatigue. From your experience, what are the most common side effects that you see with IVIG, and are there any specific factors that trigger those?
Well, everybody's different and everybody's immune system is different. And although IVIG is very similar across the board, each product has various characteristics. So it's really there's things that we can do that make it more tolerable in general. And then it's really going to be just how does the patient receive it? And we look at the package insert, and there's maximum rates that we should not exceed, that they look infused during the trials. They didn't go over a certain rate. and we would not exceed that. And in fact, in the home, we're probably a little more conservative than that as well, because, like you said, it is life changing. And with the potential for symptoms, we want to minimize those as much as possible so that every patient can get the chance to tolerate it and see that it would work for them and make a change in whatever their condition is. So the biggest thing that we look at up front is hydration. Patients that are well hydrated, we encourage patients to drink a lot, and in some cases we'll even give them pre or post or both. Um, Hydration, the rate hand in hand is really, going slow, and you start out slow and then you see how the patient does. You're monitoring vital signs the whole way because blood pressure changes are another side effect that can occur. So you're starting out slow, and if they tolerate it, then you can increase the rate. And we do that every half hour until we get to what the pharmacist would determine the maximum rate should be for that patient. And they look at, have they
And the
had it
maximum rate
before?
actually can change from patient to patient depending on how well
It
they
can change
tolerate
from
it.
patient. Yep. And, the pharmacist will look at all sorts of things for that particular patient as well, like, do they have a history of migraines? Because that can maybe increase the potential for the aseptic
Yeah.
meningitis. And do they have already impaired kidney function? Do they have a history of blood clotting? Have they tolerated IVIG in the past? Have they had reactions in the past? Um, are they diabetic? All kinds of things that they look at, what medications they're on. Have they had to have a history of allergic reactions to medications in the past? And they'll
Mhm.
want to take all that into consideration to tailor the infusion to the patient.
Now, you kind of touched on my next question. What are some of the ways patients can address side effects before their infusion? Can you walk us through some of the
Yeah.
best practices patients can follow before? And you mentioned hydration, which is always something that I tell everyone: hydrate, hydrate, hydrate.
Yes.
There are also pre-medications and other things. So, what would you recommend prior to the infusion, and then maybe some tips after the infusion, what they can do to help mitigate some of those side effects?
So, the biggest thing that someone getting IVIG can do is to follow the nurse's instructions to a T. And, you know, take the pre-medications, like you say. They get, some sort of antihistamine like Benadryl or Loratadine, and they'll get, a Tylenol, and that would hopefully offset some of the reactions,
And some patients I've even heard of
fatigue and the
getting,
flu-like.
steroids ahead of time, like a saw.
That can be one too. There's even, if patients do get migraines, they could take their migraine medication as a pre-medication, and then if things happen during the infusion, the nurse, which should be well versed in administering IG. It is a very different treatment, and they should have been trained ahead of time on all of the nuances, like the side effects and managing them. So it would be the hydration, it would be the pre-meds, it would be the nurse knowing what they're doing to follow the infusion protocol that's laid out by the pharmacist and not exceed that. And the patient should make themselves familiar with what their infusion rate should be. And they should look at, pay attention to the pump as to make sure that it's all, a double check.
Like, when someone's first diagnosed, I always like, "Well, what can I do?" I say, "Well, the first thing you have to do is educate yourself about your
Mhm.
disease, and you have to know what your medications are and what your
Yeah,
dosage, and if you're on infusion, what your rate is. The nurse is supposed to be there, but it's your body. You need to make sure of those things too."
exactly.
That brings me, to the 4th question, and, we touched on the mild side effects, and they may seem pretty awful when you have them, like the headache and the nausea and some of those, and they're significant to you, but there are worse side effects that could occur, and, they are more rare, definitely. But, can you go over a little bit of some of the serious reactions, like the severe headaches and blood clots and kidney issues? And you have talked about that the kidney issues are less than they used to be, but what causes those severe side effects? And, is there any way to tell ahead of time what patients are more at risk for them? And is there any way to reduce those risks?
Yes.
It's a big question. It's a really big question.
So the biggies are, let's go through them. Anaphylaxis. So we're going to want to know, does the patient have allergies? Have they had any sort of anaphylactic reaction in the past? And every patient gets an anaphylaxis kit in the home that has epinephrine or adrenaline and some other medications and fluids that if the patient does have a true anaphylaxis response to the therapy, then the nurse would break open that kit and follow the anaphylaxis protocol that's written out in the orders. That is so rare because we do really take the time to screen the patients up front. And if there's any concern that the patient might be at risk for that type of reaction, we would ask that the patient get the first dose in a controlled setting, like an outpatient infusion
I was going
center
to
or
say
physician's office.
the people that are really at risk for anaphylaxis, they probably are in an outpatient setting more likely, or
Yeah.
even yeah, I have one patient that's actually in an inpatient setting for their treatments.
Yeah. Yeah, if it's that bad. So that takes care of anaphylaxis. Then we go over to the renal failure. Well, that is product selection, and the product that was the reason for that black box warning is not even on the market anymore.
Right.
And that product contained sucrose, and that was what was tied to the renal failure, but we still look at, because it can be taxing to the kidney, so we do look at, do they have any sort of renal impairment? Are they a diabetic? Things that might put them at risk for renal impairment, like diabetes. And we look at things like that. And then, we would maybe select a product that doesn't even have a sugar derivative of
Which
to
thankfully
stimulate the
there
process.
are options now.
They're coming more and more. So,
Yeah.
and then there's thrombotic event that's also now a boxed warning. And that is just because of the viscosity of the IVIG and when it hits the bloodstream. And, if you're at risk for clot formation, then that could be a problem. If you're not, typically that's not something that you see. So if you've had a previous heart attack, stroke, deep vein thrombosis, we would want to know. Some patients are already on blood thinners, so that's great. If they have, that should take care of it. And just, sticking with the rate and making sure that you follow all the instructions. And then the last one is the aseptic meningitis syndrome, which is not a black box warning, but it is, a potential that can happen. And that tired, I mean, it could happen with anybody, but it's more prevalent in the high doses, like the very large doses, because IVIG is dosed by disease state and by weight. So if you have an autoimmune condition, your doses are going to be higher. Um, and if, then it depends on your weight. If you're immune deficiency, your doses are going to be on the lower side. And then again, by your weight. But it's the high doses that have been where it's been a little more prevalent. And, but we also look at, is there a migraine history? Do they get headaches now? What do they take for them? Should that be included as part of their pre-med protocol? And just taking it easy on those days, not,
That's
you
one thing I
know,
recommend is just don't go plan to run a marathon when you get done with
yeah,
treatment. Take
yeah.
take it easy on yourself.
Yeah. So, we try to make, obviously, we're home infusion, but any infusion center is going to try to make a patient as relaxed as possible and comfortable. And, if it's a first dose, we're going to take even more precautions, make sure that somebody else is in the home with them and things like that to make sure that they do okay.
So, you touched briefly on the formulation of different products when you were talking about
Mhm.
the sugar in the or sucrose, but some patients who do have trouble with IVIG do find relief when they either switch products or they switch to subcutaneous IgG or SCIG. What are the differences between the two treatments, and how does SCIG reduce the risk of some of the side effects we've talked about?
So, IVIG is going into a vein. So, the effect on the system is going to be more immediate and the reactions are going to be more systemic. Subcutaneous goes into the subcutaneous tissue, so it's absorbed more slowly, and it's not in the venous system, going right into your circulation. So the effects are more over time, and the infusion rate and things like that aren't going to, make an impact. That you're not going to get. You could get a headache, but it would be
Not
more
be as
mild
severe.
and it would be
Right.
like, over time. And the reactions are less systemic and more localized. So where the needle insertion site is, that's where you would look at irritation, redness, and how severe that is. And for that, We look at needle placement, we look at needle length, we look at, the weight, the height and weight of the patient and where they want to infuse the location, like in their abdomen or their thighs. And then we'll make recommendations for needle length. And there's tips and tricks that you could do. Like we always say, don't prime the tubing all the way out so that the medication actually drips out the needle, like stop it right before. So it's a dry stick. So there's not medication irritating your skin as you insert the needle,
That's actually a
compress
really good tip.
after that.
And it just briefly, you explained it a little bit before why, and we'll go back to IVIG real quick, why some people tolerate one IVIG brand more than the others. And I, you know, it's funny you've explained to like people they're biologics. None of them are formulated exactly the same. But
Yeah.
why would one product affect a patient more than another?
Mostly they don't, honestly. But there are patients that don't do well with one and then we try another and they do okay with that one. And that could be the product, it could be that particular batch, like that antibody mixture, it could be um
That
it
that's a
could be the characteristics of what, the formulation and the stabilizer and the pH and, a host of things. But mostly people can tolerate changing a brand. But if you have somebody who had difficulty up front and then finally got stable, you wouldn't want to change. You wouldn't want to rock that boat. So you
no.
would want to leave them on that brand. But the brands are similar. They are. I mean, they have some differences, but there are similarities as well.
So, if a patient continues to struggle with side effects, even with the what you've recommended, and even after slowing the infusion rate or trying pre-medications, what should that patient do? And what would a conversation with their doctors look like about changing the product or the dose or even the delivery method? So, if they're still not doing well on IVIG, do they go to SCIG? What are those conversations? What is
I
that kind of
honestly, I would say the majority of IVIG side effects and reactions are really manageable. It's just a matter of, you know, the pre-meds, the rest, the hydration, maintaining the proper infusion rate that works for that patient, repeating any pre-meds during getting the right brand, all of that stuff, it's pretty manageable. But if there are some patients who are going to, no matter what, have horrible reactions to IVIG. And in that case, that sub-Q would be a good option to look at. If you've tried, brand changes and pre-meds and steroids and all the host of things that you would do to manage reactions, then sub-Q would be a good next option to explore. And that's just talking with your physician first to see that they are on board with prescribing that.
and that's a good option for you, yeah.
And then you need to make sure because if you are on it for an autoimmune condition and you're on a higher dose, you want to make sure that that's something that is manageable. And there are, the concentrations, the different concentrations. So the IV products are typically 10%, and the sub-Q products are mostly 20%, and then 16.5, one of the brands is. And so you're going to have less volume and more drug. So it's a little bit easier to infuse. So, but you still, you're going to need a certain number. It's very rare that somebody just needs one insertion site and they can infuse all of that you would take the monthly dose or whatever that dose is, and you would, break it up into weekly or even twice a week, depending on
So I have
how
some
the
people
dose
use
is.
twice a week, and some do just
Right.
it depends on there's some lifestyle considerations too.
Absolutely. So you would want to make sure that, like, and what we like to do if somebody is interested in exploring that as an option is we will take their dose and calculate the fluid, and then we would kind of go, okay, that patient would need 4 insertion sites and they'd need to infuse twice a week. And then we talk to the patient about that. And
Mhm.
is that something that you're up for? And no, we do have patients that do that because they need their IG and they didn't tolerate IV, and that's what they commit to. And it's a shorter infusion. It's 1 to 2 hours as opposed to,
4 or 5.
live in one sitting. But yeah, everything should kind of be laid out I'm a big believer in laying out options for patients
I was gonna say, for me,
or
I use
people.
it like the word
Right.
communication. Communication
Yes.
is so important between you and your doctor, between the
Yeah,
patient and the doctor, and the doctor and the nurse and the
absolutely.
patient. It's gotta be open communication.
Right.
No, before we wrap up, what advice would you give to patients and caregivers who are new to IG therapy in general, and are feeling a little bit overwhelmed by side effects or the anxiety about treatment? Because a lot of the times when I talk to patients that are just diagnosed, they're scared.
Yeah.
They don't really they read about the side effects and they have a lot of anxiety or fear going into that first couple of treatments. What would your advice be?
My advice would be that most patients do really well without any reactions, but the potential is there. And again, it's about infusing it correctly and effectively. And so if you do what you're supposed to do in terms of, hydration and the pre-meds and just relaxing and just understanding, what, I'm starting to get a headache. So you don't wait, you tell the nurse or
I was
whatever,
gonna say,
and they're going to be monitoring you as well to make sure your vital signs are stable. But most patients do well with very minor side effects or none at all. So
you touched
don't
on
get overwhelmed by all the information that
yes.
what could happen. We have to tell you because there are those potentials. And it is a lot of information, but most patients do fine.
I was gonna say, my big thing is you touched briefly on it, is I've had 2 or 3 patients come back and go, "Well, I felt really awful during the infusion. I had this, that, and the other." I'm like, "Well, what did your nurse say?" "Well, I didn't tell them. I didn't wanna bother them." I'm like,
Yeah.
"No, no, no, no." You need to,
You
you
have
know,
to talk to us.
you have to talk to people and say, "This isn't working," and don't wait till you're actually not feeling
Yeah.
well.
Yeah.
That's really important. Well, Michelle, I want to thank you for sharing your expertise and your insight today on managing side effects. And it is one of the bigger challenges for our community. And it's been so helpful to hear that there are practical ways to make therapy more comfortable and successful. Thank you again for joining us today. Additional information regarding this podcast can be found on our website at www.igliving.com. If you have a question that was not answered, please contact me at acornett@igliving.com. Look for the next IG Living podcast announcement on our website for the opportunity to submit your questions. IG Living Advocate is a copyright production of IG Living Magazine, published by FFF Enterprises, the only magazine for the immune globulin community comprised of patients who suffer from chronic illness and their caregivers. The views and opinions expressed by the guest speaker are their own and do not necessarily reflect the views of IG Living Magazine, FFF Enterprises, or its affiliates.